In your Health Watch, now that kids are back into the swing of things at school, one major concern is how heavy backpacks are for students. Here to discuss how they can hurt your kids is Dr. J.P. Rodriguez, an orthopedic surgeon with Texas Orthopedics. Good to see you. Thanks for being here.
Thanks for having me.
Backpacks can get so heavy for kids. What are some of the things that you're seeing when it comes to heavy backpacks and kids?
We're seeing a variety of things. I think some of the more common stuff we see are just the neck pain, shoulder pain, and high and low back pain. Those are the most common things that we see, and it tends to be around this time of the year because the kids haven't been wearing them for very long, and now they're going back, and it's kind of getting used to it.
But some of those pains could really sideline a kiddo from maybe some after-school sport or make it hard to even concentrate in the class, for sure.
It can, and I think that at that age, it's really important to try to give them as little distraction as possible, especially when they're getting into school and kind of transitioning. And sometimes those backpacks can really cause them to have pain after, even when they're not wearing it. And
it's not just the backpack. They've got maybe the gym bag or for the after-school activities. So there's just a whole lot that they've got to haul around.
Yeah, the kids in the greater Austin area are usually pretty active, and it's a very sports healthy community. So I think that I have been seeing a lot of kids that have one over the strap or the shoulder, and then also their heavy backpack with all their books.
So how much should a backpack weigh?
So the rule of thumb is that your backpack should be about 10 to 20% of their body weight. So for each kid, it continues to go up as they get bigger. But that recommendation is something that's kind of hard to know, especially if you're trying to figure out what to do and how heavy the backpack is. But I think a little trick that people can do is actually just sit the backpack on the scale. And it's something simple, and sit it on there, put it in the kid, get out your calculator on your phone, and just kind of check how to lighten it. Be creative. There's a number of different ways that you can do that. I think that sending a water bottle that's full of water, you can send one that's empty. Another technique that people have been kind of experimenting with is debinding the big books. So the big, thick textbooks. I think you can go to any sort of paper copy store and talk to them about techniques to debind the book. And
so
then
you only take what you need.
Right, just what you need, and not carrying out all those extra heavy chapters.
That's really smart. Is there a best way to wear a backpack?
There is. Now, most kids are just kind of throw it on, sloppy, and I think the best way to do it is nice and kind of firmly tight. You don't want any space between their back and the backpack. So that extra space and hanging down that you sometimes see at the top, you should try to get that to kind of come down. Another good development is that the kind of strap across the front, and those help you actually bring that space down and contribute a little bit less to some of the discomfort. The last thing is the backpack shouldn't go below the waist. So if it's kind of sagging down too far, then maybe rethink the size and also kind of tightening up those straps. And
when should a parent say, okay, we need to go see the doctor for what's kind of going on? I think parents usually have pretty good intuition when it comes to this kind of stuff. And I think being aware that when your kids are complaining about things, that it is something to kind of listen to attentively, because they can have some issues. You can develop pinched nerves and different things like that that are a little bit more serious. And the kind of red flags for that will be if they start having pain that's going down their arm or kind of wrapping around towards the front, and anything that's just not getting better. Yeah. Certainly don't want to see those kiddos sidelined from any of their activities. Right. Dr. Rodriguez, thanks so much. And when they go back to school on Monday, wear that backpack the right way. We appreciate your time. Thank you.